Hi there, my name is Dr. Mureo Kinuvia. I'm a plastic, reconstructive and aesthetic surgeon based in Nairobi, Kenya. Now, there exist plenty of misconceptions about what plastic surgeons do, so allow me to explain. As plastic surgeons, we restore, rebuild and make whole. What do I mean by restore? So as plastic surgeons, we restore form and function of whatever body parts we're dealing with. If we take the example of cleft lip and palate, some would argue that the function of a face is simply to look like a face. But if you really think about it, there's also other functions of the face that have to be restored for us to be considered successful. In the example that I mentioned, cleft lip and palate, these are such things as the ability to eat and the ability to speak in a manner that can be understood. Moving on to rebuild. Now, what do I mean by rebuild? As plastic surgeons, we're often called into other major operations, resulting in the moniker of being the surgeon's surgeon. Let's take the example of tumor surgery. When tumors are removed, they're often removed to the margin of healthy tissue, and this can result in a large defect. So it's not enough to rebuild that area of the body so that it looks like it did before. It must also function as it did before. And this is where things like peripheral nerve surgery come in. And now we come to make whole. A fear that's often expressed by our patients is this fear of living with a physical reminder of the thing that they went through. In other words, looking like their story. Let's take the example of a patient who was involved in a car accident. The scars serve as a constant reminder of the trauma that they underwent. And this can extend all the way to things that we're not happy about with our bodies. Here we're talking about the young girl who had larger breasts than her friends, perhaps even gigantomastia. This can result in constant teasing, bullying, and this is not a patient who wants a constant reminder of this point in her life. Yeah? So as plastic surgeons, we understand that this fear is not trivial. We live in a society that places great emphasis on aesthetics, and our ability to feel comfortable in our bodies influences our ability to interact with the world and our ability to engage with the world, really. As plastic surgeons, the way we encompass the idea as doctors of do no harm is that we're not satisfied until our patient is both healed of a disease and feeling comfortable, whole in their body.